Thus, Dr. JAVED AKTHER, BHMS MPhil Physiology, a legend from Pakistan, member, National Council for Homeopathy, chairman of Professional Development Program, Government of Pakistan. Many years of teaching experience, and the topic is very interesting on can we grow back lost fingers with homeopathy? Case of dermatological self-cannibalism, autocannibalism is a topic, and unfortunately our guest is not yet joined. Maybe some technical problems. That may be the reason. Whenever he presents a topic, there will be some novelties there. This one is also not an exception. Can we grow back lost fingers with homeopathy? That's a topic.
Batch कौन सा है?
Unfortunately, our guest is yet joined. But I don't know what happened. Maybe some technical problems. And Dr. Nudan Sharma, what is your experience on this platform?
Amazing, sir. Amazing. Sharing knowledge is a good objective, great vision. IFPH is doing great job, sir. And I consider myself very, very lucky to be part of this platform. So, and it has been wonderful to be moderating in Hindi session.
Yes.
So,
yes, you have done a commendable job, not about that. So the whole fraternity should salute you, Dr. Nudan, as well as our Sahani sir. Now our honorable guest, JAVED AKTHER sir, just joined. Sir, welcome. We have already completed the formality. Please proceed, sir. A wonderful topic, I think. Yes, please.
Good morning, good evening. IFPH forum to all the dignitaries and all respected homeopathic well-wishers and all the doctors and colleagues and my seniors. Today is the 12th 74 session. It's a great, we are really congratulate to all of you are doing a lot of efforts and doing excellent job. So my topic today is about the homeopathic topic. Today, I named this topic, can we grow back lost fingers with homeopathy? Basically, it is not a scientific name, just it's a name I given to for the attraction for the other people who like homeopathy, who love homeopathy. So, but homeopathy can play a role in the different diseases, in different issues of the problems. So the abstract of this topic is, first I'm going to introduce it. A 4-year-old patient was diagnosed with dermatophagia, a body-focused repetition behavior. Focused repetitive behavior characterized by biting one's own skins, often on the fingers, hands, or forearm. Research suggests a potential link between dermatophagia and stressful life, even in school-age children and adolescents, indicating that the behavior may be triggered or exhibited by anxiety-related disorder. Additionally, the child suffered from tinea pedis, a foot fungal infection, which did not improve with allopathic treatment. The condition caused distress to the parents as they struggled to control their child's skin biting behavior, resulting to bandaging the hands without success. A homeopathic case was conducted using Segel protocol, and a single homeopathic remedy was prescribed, resulting in the cure of the child. The patient was observed for 1 year following treatment. This abstract highlights the successful homeopathic treatment of dermatophagia in a child alongside the ineffectiveness of allopathic treatment for both dermatophagia and tinea pedis. It suggests the potential efficiency of homeopathy, particularly when following specific protocols such as SEGAL in addressing complex behavioral and dermatological conditions in pediatric patients. Now, what is the version of the patients? And because when the child is so small, his mothers and both versions are equally important. The child name is Muskan, age 4 years. The complaint, eating finger at the age of 6 months. Aneurosis. The second one, the third one, the tinea pedis, toes of feet beneath the fingers, dry, itchy, scaling, rough, cracked skin, palm rough and rashes, distal fringes almost eaten of both hands, right hand, index fingers and thumb eaten till middle fingers, middle fringes. This is when I have taken the case, the doctor, tell me about Muskan. PM means mother of the patient mother, age of 6 months, injured by glass or one finger. She started biting fingers of both hands when her new sibling born. Actually, it was slightly start, but the extremity was, the intensity was raised after some time. Doctor, eating on fingers? Yes. Doctor, I see piece of flesh, her mouth, blood oozing her fingers. I used to clean fingers and bandages, but she removed the bandages. Definitely, child doesn't know when you bandages the hands. So the child can remove and again. It was happened with the child. What I observed over there, patient is sitting cool, silent, and not disturbing. I have examined the child, palms very rough, dry, cold, but both hands, especially half fingers, rest of the body not cold. Eruptions at palms, fingers of both hands eaten till flinges, second and middle flinges are eaten, feet sole cracked rough. Then doctor asked, tell me more about child. Patient mother, cuts appear usually beneath her feet, rest of the body normal at the age of after 3 years. She is quite intelligent with proper speech, but she gets very angry and bites herself. Then she uses to say, if you are not giving it back, I am going to bite myself. Then what you do? Patient mother, what else? I give back the things to her, then she gets happy. Doctor, what about her sleep? With whom she sleep? Patient mother, she takes sound sleep. That is normal. She has a habit of keeping my hands on her chest. Then she sleeps. Otherwise not. Doctor, what about your urination? Bedwetting, using pamper, her behavior with others. What is the behavior of others? She loves everyone in her family. If someone is leaving home for work, she used to call and beg. Doctor, does she communicate with the guest or she is shy? She is shy. Doctor, if she's friendly, patient mother, she's friendly and she's candies. If she has a candy, she shares with her cousins, also living in the same house, but not with her little brother. She does not love her little brother. She strikes him, but friendly with her little cousin. Patient's version. She started biting fingers of both hands with her new sibling. This is the case of the child. Whatever the child, the mother and whatever I have seen over there, and all the version of the patient is I narrated here. Now I have analyzed this version. What the patient's version says, basically, homeopathy deals with the individuality. It deals with the whatever the disorder over there, whatever the disease over there, what the patient's gestures, what the patient says, how to observe it. That is your observation and that. And at that time, First rubric I took here, she started biting fingers of both hands when her new sibling born. This is the one thing which I seen here. So I took the rubric here, jealousy children between when a new baby takes the attention of the family away. This is the first rubric. And second one is the rubric is there. She bite the both hands, a finger of the both hands. And I took the rubric biting paws. Paws basically, I will explain this rubric later on. Paws is a panja, show biting paws. And third one is the patient is sitting cool, silent, and not disturbing. This was my observation. So I took the rubric sitting inclination to sit stiff, quiet. She is quite intelligent with proper speech. I took the rubric precocity of children. And then what the parent said, she gets very angry and bites herself. Then she uses to say, if you are not giving it back, I am going to bite myself. Actually, I took a here rubric, is a very important rubric, chaotic chill during. Actually, why I took a rubric here, there are jealousy, selfishness, possessiveness, anger, and jealousy, and indecisions. All these things, when to collect it collectively, it goes into chaos. So I took the rubric here, chaotic chill during. She was in chaos. She gets very angry and bites herself. She is too much jealousy. She's a jealousy, selfishness, and indecision. Then what can arise over the chaos is arise. Because she has become a chaotic disorder, confusional disorder. And she uses to say, if you are not giving it back, I am going to bite myself. And she bite her paws. She's a bite. She has a habit of keeping my hand on her chest. Then she sleeps. Otherwise not. Rubric clinging children in mother-child cling to the hand to the mother. Child will always take the holding or being held constantly mother's hand. This is the another rubric. Patient is shy. So I took the rubric bashful behavior children in. This is the chart of the case, all the chart, and this is the radar opus apex chart. The remedy comes pulsatilla, and now it was not the first. Basically, when I patient visited at the first time. At that time, my camera was not present with me, and I did not took the picture of this. It was after 2 weeks, patient was visited. All the fingers was damages or wounded, and the skin was too much rough at the first visit. They are all the injured area, 1, 2nd, 3rd, 4th. This is the first palm of the entire whole pass. This is the second, and this is the second hand. You can see it. Here is the wounds are reappeared, healed up over there. Skin was too much rough at that time at first visit. This is the before treatment right foot, tinea pedis, and after the 2 weeks, you can see this is the healed over the skin was healed over there. This is a child. Now I'm going to explain. Remedy was given at the 6 centimeter scale, pulsatilla. Aneurysm, no complaint. Patient skin was improving. Second visit, patient and mother was visited, no biting complaint. Improving slow. Then the third week, single dose. Fourth week, placebo, patient status improving. Fifth week, no complaints, skin disorder cured, no eating of fingers, neurosis cured, nail in regrowing, patient family satisfied, treatment placebo. This was observed 2 years. What is the meaning of this rubric, chaotic chill during? Chaotic describes state of disorder or confusion where things may feel disorganized or unpredictable. Chill during indicate that this chaotic state is experienced specifically during a chill or cold sensation. Pulsilla, this remedy is derived from the window flower. Pulsilla patriensis, it is often indicated for the individual who are emotionally sensitive, easily influenced by their surroundings, and prone to frequent changes in mood and behavior. Chaotic Pulsilla individually can experience a chaotic mental state disorganized by emotional instability, indecision, and feeling of being overwhelmed. They may struggle to maintain a sense of order, a structure of their thoughts and action. Chill during Pulsilla is known for a peculiar symptom of feeling worse in cold, damp condition, or chilliness experienced in Pulsilla. Patients can exacerbate their emotional sensitivity and chaotic mental state. Coldness can intensify their feeling of insecurity and emotional vulnerability, leading to the state of increased confusion and disarray. This is basically at the mental level, not physical level, the meaning of this. And what is the meaning of biting paws? The term paws symbolizes the extremity of limbs and the individual, particularly the hands or feet. However, since humans do not have a paws like animals, in this context, paws metaphorically refer to the hands and our feet. Symbolically, the hands and feet represent our ability to interact the world or to move forward in life. Biting of one's own paws can symbolize a self-destructive or self-injurious behavior that interferes with one's ability to engage with or navigate through life effectively. This is basically biting paws, the metaphorical meaning of this. So now I'm going to explain. This is a Pulsilla versions. Pulsilla, why I took this case, and the patient was cured with the Pulsilla 6 centimole scale. Not I used the high potency, only I used the low potency. Why I use the low potency? Because basically there are physical injuries over there. Mental symptom, I took the state of the mind. There are two things. Where one is the normally when we are discussing about why you are using the low and high potency, one is the mind symptom, second is the state of the mind. What is the difference between normally mind symptoms is mean the fear, anxiety, like that. And when we will take the state of the mind of the person, it is basically both of some symptom we are converted into the physical into mind level, mind rubrics. So state of mind, when you are taking state of mind, there is no physical mind symptoms or actual mind symptoms. There's a fear, anxiety, there. I take the state of the mind. The mental symptoms of the patients was not there. Number one, physical symptom was dominant, and injuries were there. So I took the low potency of 6 centimeter scale. If 6 centimeter scale is not working, then I'm going to be high potency. So the patient was responded with 6 centimeter scale of Pulsilla, only few doses. Patient was observed for the 2 years. Once after the 1 year, the patient was visited to me. The doctor, she again bite. At that time, I have given the 200 or 1 ml, I don't know. At that time, I've given 1 ml 200. So again, patient after 2 years, then she was visited again. Then they told me that I have no complaint. One thing I'm going to tell you here, patient was visited to many physicians in the hospital. They did whatever they did over their treatment, and definitely they have no got any response. So it was the major tension was the patients and parents. She was biting, and that is why the word "can we grow." At the last pictures, nails are appeared at the fingers. It was a tremendous result of this. Basically, fingers are lost, but gradually nails are coming over there. It's a very beautifully what the homeopathy, miracle of the homeopathy do over there. Now I'm going to tell you what is the child of the pastilla child. What the pastilla child would do there. Pastilla child basically is a feminine character of the pastilla child. Is the most feminine type because she lives almost entirely through her emotion and does not suppress them. She has an intellect, but it is used exclusively in the service of emotional need and desire. This is why her ideas can appear too changeable. Emotions are very changeable things, especially when they are given free rein and not suppressed. And since pastilla thought are generally concerned with emotional satisfaction, they tend to be highly predictable, unpredictable. Pastilla child is timid and with stranger. If they appear hostile, she will become frightened very easily and will not speak to them at all, but instead hides behind her parents. When she is established, however, that stranger is nice, showing them her favorite tie and telling them her most prized secrets. Pastilla is extremely dependent upon her parents. She will become anxious if they are out of her sight for more than a few moments, and in public, she will tend to stay very close to them, often holding a parent's hand or every clinging to her mother's dress. As long as she feels loved, she will take great delight from the little playful interaction with that make up with much of her communication with her parents. And she is particularly fond of physical contact. All pastilla have a great need for physical warmth and contact, whether they be children or adult. They will languish blissfully in the arm of loving father, utterly devoted and at peace, and will jump at any opportunity for physical affection. Favorite aunts and uncles will also be enjoyed enormously by the pastilla child, particularly if they enlarge her and are physically affectionate. When pastilla is feeling happy and secure, she has a very characteristic points, which is extremely charming and attract a great deal of affection. Her wide, innocent eyes are at once shy and playful, and her smile is both tentative and little pleased with itself, as if to say, "Be nice to me. Look how lovely I am." It is, if you see the child of a small child, so he will say you when she will affectionate you will when it free with you, she will ask you how I am looking like. I am lovely. These are these are the wordings of the pastilla child. Pastilla children of both sexes are highly emotional. They are generally devoted, affectionate, and mild, providing their emotional need are met by their parents, but they tend to demand instant gratification. And if they feel deprived, they will cry and be petulant until their needs are met. Pastilla is a natural type. If the pastilla child hurts, she cries, whether the hurt is emotional or physical. There is no attempt to disguise her pain, and at once it is over, it is forgotten immediately. Well, pastilla is one of the more fearful type. Pastilla children are prone to all manners of fear, especially when they are feeling insecure as a result of inadequate parental attention or change of circumstances. Little children are very often selfish in their attitude. It is the emotional insecurity that make pastilla selfish. She tends to put her own emotion needs before all else and will create a sense of necessity to be noticed. and taken care of alternatively. She may wean and moan pointedly if she is unhappy in an attempt to attract loving attention. After personal interaction with loving intimate, Pastella next love is the enjoyment of senses. Be noted. Pastella's next love is the enjoyment of senses, as well as the being highly tactile. She loves visual beauty. She loves visual beauty and also the taste of her favorite food. Therefore, most of the things the Pastella like the Mitchells and like that. And she like visual beauty. Once again, she is highly personal and fussy about her preference, whether she is 5 or 50 years. Young Pastella will admittedly refuse to wear a dress if she doesn't like the color or palette. She is often extremely fickle. Extremely fickle means changeable. She's simply fussy, like a spoiled child who has her own way. Naturally, the more Pastella child succeed in manipulating her parents with her sudden outburst of emotion, the more spoiled the will become. Pastella will tend to get very jealous of other children if they are favored by her parents. In fact, she will get, you can see here, Pastella went to get very jealous if other children, if they are favored by the parents. She will get jealousy if anyone who takes her parents' time. On the time of the best friend, in her jealousy, she is apt to behave petulantly, taking her spite out her competitor as well as her loved one. Thus, she may break her brother's new tie if she thinks it is nicer than her, and refuse to eat her lunch if he is center of attention on her birthday. Here is the Pastella is a most feminine type because she lives almost entirely her emotion, are not suppressed intellect, but used exclusively in the surface of emotional need and desire. This is the way her ideas can appear to changeable. Emotion is a very changeable thing, especially when they are given free rein or suppressed. Since Pastella, though are generally concerned with emotional satisfaction, tend to highly unpredictable. Confusion of partiality. This is the topic related is confusion, which I chaotic chill during. I have used it. Pastella can get into mental fluster when she is upset. Pastella is very prone to indecision. This is presumably because she listened to her emotion. She listened to her emotion. Rather rational. This is which react both positively or negatively to every possibility. This paragraph I used took the rubric chaotic chill during. Pastella is basically it is emotional. There is a confusion when Pastella lives so much in her emotion. Her thinking tend to be somewhat woolly. It lacks precision and clarity much of the time. Pastella women are liable to give up easily when rational analysis is required, including the analysis required for practical tasks like changing, just to give the general example, changing an electric plug. She will most likely, if she attempts such a task at all, attach the wire any old way. This is basically, thank you, sir, thank you, please. So this is a version of the Pastella and why Pastella do like that. But normally the doctors think Pastella does not injure herself. It basically, she went into the chaotic state, confusional disorder. Then when she is go to the confusional disorder, then what happened? Whatever there good, she's indifferent to the pain there. Here I'm going to took the another rubrics which are related to this. You can see here. Yes, please. Indifference pain to pain. You can see here, indifference pain to men. Delusion ruined will be ruined. Delusion woman, evil woman will injure the soul women are. Fanaticism, thoughts controlled of thought last. Unconscious chill during. Anger, jealousy with. Jealousy, selfishness. These are the other rubrics which are complementary to this topic. But three rubrics are enough to take this case. Jealousy, when the attention take away. Number one, biting pause, chaotic chill during. The case of the pastilla. Thank you, sir. Thank you, please. You can ask the question, please.
Yes, wonderful presentation. No doubt about your potential to present some exclusive and totally novel topics. This is also not an exception. Nobody can imagine such a transition will happen with the medicines. Only plastic surgery may be doing something, but cannot replace the even nails. But that did happen. Real cure. Wonderful. Congratulations, Dr. JAVED AKTHER. You are a real legend. It's time for discussion. Those who would like to participate can raise your hand. Dr. Sevgi, are you there? Definitely you have some to express this wonderful presentation, Dr. Sevgi. We'd like to hear from you.
Yes, I'm
please.
here.
Yes.
It's a wonderful case. Thank you, Dr. Javed, and all of you. Sorry. Yes, pulsatilla is a very different view of patients. We now we see, and I have patients like your patients, and it's a 19 years old girl, and every time she eating and tearing all of the nails and fingers fit, and she afraid of mummies go anywhere or want to see any position. I want to see I want must to see my mothers. If another room, we go back and control of the mummy is here, and very emotional and very cheerful, but at the same time very jealous. And pulsatilla is very benefits of her symptoms. Thank you, Dr. Javed.
Thank you, ma'am. Thank you, ma'am.
And I want to learn the last picture. Do you have your patient's fingers? Last pictures. Thank you.
Yes, yes, please.
Thank you, Manoj. Good evening.
Good evening. Thank you, ma'am. Thank you, please.
I think these pictures should be added along with our posters. Then definitely we have a lot of participants. So wonderful, unbelievable. Yes.
Oh, yes, yes. Thank you.
Thank you, ma'am. Thank you.
Really, I think such a cure, it is beyond all imaginations.
Therefore, ma'am, I have named this topic, can homeopathy grow the last fingers?
Yes.
This is a query marks.
Really excellent. Now, Dr. Seetal, are you there? Dr. Seetal, you can unmute now, please. Yes, unmute. Please unmute.
Hello?
Yes, yes, please.
Yeah.
Yeah.
Yeah, good evening, sir. Actually, I wanted to ask this question to sir, that he has taken this rubric, chaotic chill during. So chaotic, I understood, but chill during, so metaphorically this rubric is taken. So how do we understand the chill part of this rubric in this situation, like of this case?
Okay, ma'am. Thank you, ma'am. Thank you. Normally, when we are sitting with basically here I mentioned it, pastilla senses. It is amusement, enjoy. When we are using the chill kare. Normally we are saying to when we are sitting with the friends, What are you doing? Chill, all right? Chill. We are doing chills. Basically, it is enjoyable. When she is in a chaotic state, chill during, basically this is enjoyment. She's the clarity, chaos over there, and it's the chills of the patients. This is the basically, it's a metaphorically and metaphysically. Not chill is that coldness. It's the mind rubric, not physical rubric. Mind rubric is the chill, is the enjoyment, enjoying time. Yes, madam, please.
Okay, Dr. Sridhar. That is why pulsatile is often described as a female medicine. These are the characters often dominating. They are always jealousy. They are comparing. At the same time, emotional, both positively and negatively. Yes, we can say a lot of medicines, homeopathy material.
Sir, one thing I'm going to tell here.
Yeah.
Especially in the region of the India, Pakistan, and these regions,
Yeah.
especially mother-in-law of the male, mother-in-law of the male, mother-in-law of the female, meaning mother of the husband.
Yeah.
She is too much possessive. She wants to say the son should stay with me. Don't go here and there, and don't even go at night to her wife. She's a typical pastilla. She was too much possessive, too much selfish. She does not share their love, affection, and she must say my son, married son, should stay with me and even affectionate to me. Most of the pastilla, if you give the pastilla to her mother, your problems will be subsided.
Yes, there is a reference from Dr. Stuart Close. He says in some chapter, I'm not remembering the exact chapter, but if you want to prove some medicines, you can give it to your mother-in-law, he says. Dr. Stuart Close is there. In his homeopathy, it is said about this, the emotional, it is often positive and negative. That's also an important thing. Then
highly emotional.
Yes.
Then the rational.
Then the potency is said about the state of mind and the mind symptoms. So what is the difference between these two?
Sir, the state of mind, basically, mind symptom is the mental symptoms. And state of the mind, the rubric is the mind, but state of mind, the particular time, at a specific time, what the actions, what the patient do or not to do at that time. This is the state of time. What the feelings, that is the mind. But at the particular condition of that, at particular time, that is the state of mind. At state of mind, patient was sitting cool, silent, this is the state of mind. And what the patient feels, that is a mind symptoms, mental symptoms.
Yes, sir. Thank you. Now there's some comments are there in the chat box. This will save many marriages. One comment from Dr. Esmi. If anybody would like to ask something, definitely has a golden opportunity. Dr. JAVED AKTHER is a legend from Pakistan and can answer almost all your queries. Anybody who would like to participate, please raise your hand. How much time did it took, sir, to for this transformation?
Sir, basically, patient result was after the first and second week, the biting are no complaint of the biting. And it was cured within 3 or 4 weeks. And I was observed the patient and follow up the patient for 2 years. There was no complaint of this. And only a few doses are given at the onset and later on a 201 mg dose given. Because it was a reoccurrence and our mother told me again she bites. So I've given that. However, that response was excellent. The skin was clear. No biting was there. Tinea pedis was cured. Patient was healthy and absolutely nothing to worry.
Singly, rarely, and minutely. Exactly. Wonderful job. There's a question from Dr. Sergey. Please explain a pulsatile man. How are they? It's a question from Dr. Sergi. Sir, please. Please explain a pulsatile man. How are they?
Pulsatile man. Sir,
Yes.
I'm going to give some examples of pulsatile man. A man who visited to me, just it's not a related topic, but I'm going to explain the pulsatile man.
Yes.
And patient, when he visited to me, all the characteristic of the feminine type, what he was saying to me, and when he visited to, basically he visited to me for their sexual disorders, and that's a, you know it, I'm doing the working, when I'm working at the home, I used to washing the cloth, and I used to get tired. Then I told to my missus, please give me Carist, and like that all. That entire talking was like feminine, and he was using like the her dress was not feminine, but the style was feminine. And when I asked deeply question, how you feel your sexual problem, that's why it is not exposable. Please don't ask me like that. Okay, I will write you. Then entire version was the feminine.
Yes. The
And
body language.
body language and that. But basically, then a lot of medicine over there, but the character and shyness and another thing, that here is very important rubric, character lack of. Why I took the rubric here? He told me I have a daughter, and because she get married with her cousin, and her mother asked me, would you, what is your opinion if she get married over there? So I told her, I have no concern if your daughter, you whatever you do it. This is the character lack of, means uska kirdar hi koi nahi hai. This person have no character, no role of the in their family, not playing the role, not having the role. Later, so now the pastilla was confirmed. Lack of character. It means having no role in the any decision making, any whatever. So all these things are coming. The pastilla comes. You can't imagine it. I have given the 200 potency.
Yes.
After 2 weeks, the patient comes. The patient told me, but the personality was not changed, but the problem was solved. Doctor, what you did it? I used a lot of medicine, allopathic and whatever that drugs over there, but never satisfied. But you did whatever you did it. Really, I'm much satisfied. Only pastilla, single dose, 200 potency. Basically, when you will reach the similum potency, similum medicine, similum remedy, you can't imagine it. What a wonderful result you can get over. But
Yes.
you need it.
The transformation remedy. Yes. Yes. Sir.
Another mildness of the pastilla. Basically, what is the mildness? What is the basically normally we take the mildness in routine cases, but in disease condition, in suffering condition, how you take the mildness? One of the patient who visited to me, she was suffering with the osteosarcoma. Osteosarcoma. You can imagine it. The pain of the osteosarcoma, it was too much severe. It was intolerable. She was taking a tranquilizer and injectable medicine after one hours, but there was no relief. She was severe pain. She was weeping and continuously. And when she come to me, I asked. She was about a 16-year-old girl. I asked, how are you? What you are feeling? She told me, doctor, I have a pain, but don't worry about this. It is I don't take the tension. Okay. Then any concern? No, I want to become a doctor future, and you have a severe pain. You want to become a doctor, and you have what a terrible pain. And she told me, I know it's a pain, but what I can do? This is the mildness of the pain. This is the mildness of the pastilla. You can't imagine it. At that time, I have given the 6 centimeter scale of the pastilla to the patient. You can't imagine. Normally, patient was taking after 1 hour injectable. Then it was little relief. I detained the patient in my clinic for 12 hours. Only single dose was given. 12 hours pain was no there. And daily it was given, but it was daily given for 15 days. After 15 days, patient was expired. It was third and terminal stage of the cancer, but pain was not there. This is the role of the mildness of the pastilla of homeopathic medicine can play a role in the human body in whatever the condition. As you know, that certain cases, every system have limitations. It cannot be cured, but we can help the patient to taper down the severity of the problems. This is the tremendous type of the help of the patients.
Okay, sir. Yes. Dr. Muhammad Ali, please unmute. You can unmute now. Yes, please. Unmute now.
Assalamu alaikum and good evening. Once again, I appreciate Honorable Dr. Sir JAVED AKTHER, which present a very nice and beautiful.
You are muted. Please unmute. Unmute.
You are unmuted. Please mute it. Unmute again.
Has a very beautiful and incurable case of biting of their fingers, which totally we see the incurable case. But its approach of mind method, jealousy, biting paws, and poetic chill.
You are unmuted, I think, so again. The voice is gone.
Please unmute, Dr. Muhammad. Please unmute.
This is unmute, sir.
Okay, now. Again, muted.
Okay, we'll come with that.
Keep away from hand from the laptop.
Okay, we'll come to you later. Now, Dr. Seedal, are you there? Dr. Seedal. Yes, please.
Hello, sir.
Yes,
I had 2 questions. One was that the slides which you shown us for pastilla, so they are taken from which book? I wanted to ask that. And second thing, I am seeing a rubric here, effeminate. In that also pulsatilla is there. So the pulsatilla man that you were describing, so effeminate suits that rubric, or effeminate means something else? Like, could you please explain that rubric as well?
Basically, today this case, I used the repertory. When I does not understand any reference of this repertory, then I go to the different type of the materia medica. So rubrics, I took the synthesis repertory. This only biting paws is present only synthesis repertory, not any other. And chaotic chill during is covering the Murphy and synthesis repertory. This is a version of this. So the case, basically, when we are describing the here I would describe the case of main feminine character of the main effeminate. Basically, effeminate, that the person who has a character, or their feelings and their actions look like their feminine behavior. That is called, that is the effeminate.
Okay. Now, Muhammad Ali, are you ready?
Yes,
Muhammad
yes,
Ali,
sir.
please. Yeah, please.
Yes, sir. Yes, sir. Assalamu alaikum, sir.
You will come, sir.
Good evening, sir. Sir, once again, today present a very nice and beautiful case presented by Honorable Sir JAVED AKTHER, which is totally surgical case and physical looks, but solve the case by surgical method in which rubrics are jealousy, biting, pulse, and chaotic chill urine. This is a very beautiful approach to reach a specific dysphagia, specific pathology through mind method, which not exposed by physically, and cover a very very nice method in a short time and nail our growth. Sir,
Again, you are muted. Just like pulsar, like changeability is there. Muted, unmuted. What happened? Dr. Homeopathy, please unmute.
I know, I don't know. I don't know.
Okay, now it is okay. Please.
Thank you, Jit.
Okay.
Thank you, Jit. Thank you so much. Dr. Lee, thank you, please.
Okay. Now, Dr. Dhanesh, please.
Good evening, JAVED AKTHER,
Good
sir. It's really
sir.
a wonderful case once again. Nobody never thought of pulsarilla in this case, because always people may think about other remedies, because treating a local malady or a one-side disease, when people are prejudiced, they may go in a different way. But what you have shown is that whether it be one-sided or both-sided, it doesn't matter. What matters is the patient. The patient means the mind of the patient. And you really go through the mind in a beautiful way. You got the rubrics and symptoms rightly. And even after getting pulsarilla, you then studied pulsarilla again and again, and make sure that your patient is a pulsarilla patient, and you have the confidence in you that this pulsarilla will definitely cure the patient. And that's the beauty, and that's the result.
Yes.
Thank
Congrats.
you, sir.
The exactness compound is there, and again studying the case well, as mentioned by Honeyman. Now, Dr. Naveed, I think he's driving. Anyway, Dr. Naveed.
Dr. Naveed, welcome, please.
Yes. Please, you can proceed, Dr. Naveed.
Hello, sir. Hello, Dr. Bidoj. Yes, I am driving, and I just go through the sir case, Dr. Javed sir case. Really, it is unbelievable. I agree with Dr. Dinesh that such a miracle can homeopathy can perform, and we see such miracles in the homeopathy. Such case which is totally incurable or not up to the treatment, but homeopathy can make it possible. And I appreciate Sir Javed, who really put a great effort in solving this case. And his selection of medicine is very excellent. All the rubrics fall in his description and his prescription, especially the one rubric which is a biting pass. Excellent, sir. Excellent.
Thank you.
So
Thank you,
congratulations to you, sir.
Thank you, Dr. Naveed. I'm really thank you. Thank you for.
Yes, Dr. Naveed. We know that you are driving the vehicle, so it's better to hold conversation during driving. Thank you for joining with us, Dr. Naveed, once again. If anybody would like to participate, to ask something, you can ask. Dr. Dhanesh, what about tomorrow's program? Any announcement?
Tomorrow we will have a session from Dr. Madhusudana Panikar, and he will be talking about the Ferran groups of medicine.
Definitely, he's also a legend, a remarkable personality, treating a lot of wonderful cases, unimaginable. We have the strength with the homeopathy therapeutics. This case is also not an exception from Dr. JAVED AKTHER, the growing finger. Nobody can forget it again. Then, if anybody would like to participate, Dr. Tansila, are you there? I think she's a student of Dr. JAVED AKTHER. Dr.
Yes.
Ansila.
Yes, yes, she is there.
Yes, please.
Assalamualaikum. Good evening, everyone.
Welcome, Dr. Sita, please.
As Alhamdulillah, Dr. JAVED AKTHER is a star of homeopathy from Pakistan, from all of us, and it's not easy to wait to explanation and exact elaboration about the mind skills, and it's a magic solution of this case, and it's a good phenomenon of homeopathy for all of us. And I think we must learn from the Sir JAVED. It's a beauty of the single dose and single remedy, but some of the asking about this case, what's magic of the single remedy, and it's not possible. But incurable case and exact healing procedure of the patient, it's not easy. The confident on the single remedy. So we are all get the confident on single remedy due to our teacher Sir JAVED. So I always thank to Sir JAVED, and thank you so much, sir.
Thank you so
And
much.
thanks to IPHR for Sir Manoj, sir. Thank you so much for inviting us.
Yes, definitely. You are a regular participant, a wonderful personality too. Now it's time to wind up session. May I invite Dr. Sevgi from Turkey to express a lot of thanks. Dr. Sevgi, please. Yes, please.
I am here. Thank you, IFPH, really. And I am very happy every day. I listen a lot of good case and learning much things. And maybe we are collect and we are collaboration. And later we will do good things for humanity. Thank you.
Thank you, Dr. Zivid. Thank you, Dr. Zivid.
Yes,
Really grateful. Thank you.
anyway, wonderful presentation. I think the most important, most unbelievable presentation in this IFP is the 1274 day. The view, the pictures, the fingers are growing, the normalcy, and even nails are going. No other science can do this. Dr. Naveed, what we can say? Please, anything more?
Yes,
Yes,
I am audible. I am audible.
Yes, audible. Yes, yes.
Okay, thank you, Dr. Manoj, and all the respectable team of IFPH. I congratulate Sir JAVED, who presented a very beautiful case. It is a very incurable. And I agree to Dr. Dinesh that such miracles can only take place, can only happen through the magic of the homeopathy. And Sir JAVED put a very great effort, especially one rubric, which is the biting pass. And that is the entry of the point, entry of the case, and who always selected the very accurate and up to the point rubrics.
Yes.
That made it possible to cure the case.
Yes,
so
okay.
congratulations to you, sir. All times you have presented a lot of incurable cases and which show the miracle of homeopathy.
Yes.
Congratulations to you, sir.
Yes, three things are needed: wisdom, patience, and courage. Well, these three things are blended in this case. With the remark, let me conclude today's explanation. Hope you that we will be back again tomorrow. Till then, goodbye, and Dr. Shaila for the continuation program in Malayalam.
Thank you, sir. Thank you.
Okay, thank you, Dr. Manoj.
Thank
ഒരു
you.
ഇടവേളയ്ക്ക് ശേഷം എല്ലാവർക്കും